Hello, I'm Dr. Scott Johnson, OBGYN at Grand Itasca here in Grand Rapids. Menopause, by definition, is the cessation of menses for a 1 year's period of time when the ovaries have stopped functioning. Perimenopause is that time leading up to menopause where there are changes hormonally that are going on. It's not uncommon for a woman in her early or mid-40s to start to have changes where the ovaries are not functioning quite as good as they used to. So she might have some months where she feels very normal and has a regular cycle, no hot flashes or sweats, followed by another month or two where bleeding might become a bit irregular, and she's starting to develop some hot flashes or sweats. That can last for months or for many years up to the time of menopause. The average age of menopause in the United States is 51. It's considered normal for menopause to occur anytime after the age of 40. If, however, it occurs before age 40, a more thorough evaluation is needed to make sure there is not some other hormonal or major medical issue causing menopause to occur early. The most common symptoms of menopause itself are what we call vasomotor symptoms, which are hot flashes or night sweats, which are fairly sudden onsets of feeling warm, sweaty, maybe palpitations of your heart that come on and can be quite symptomatic. They can occur in the daytime, or they can occur at night, waking you out of a full sleep. Another symptom that often is quite bothersome to women is sleep disturbance, and it has been shown that women during the time of perimenopause or menopause do not sleep well, wake up frequently, and so often a chronic fatigue can develop because of that. The last symptom that women will often describe frequently is that of vaginal dryness. The vaginal tissues need estrogen to stay healthy. The lack of estrogen in menopause causes the tissues to become thinner, less lubricated, and thus produce a number of symptoms related to dryness. There are a number of treatments that can help the symptoms that were mentioned. Everything from hormonal help, hormonal regulation, or replacement of some hormones for symptoms, to non-hormonal options that can help with hot flashes, sweats, or bleeding issues. All of those can be discussed with your doctor. And in most cases, symptoms can be made much better and improved upon. Menopause tends to be less problematic in women who eat healthy and maintain a normal weight and maintain a regular exercise schedule. So those are things that can always be improved upon, which tends to help women with their menopausal symptoms. The time to see a physician regarding menopausal symptoms is basically twofold. As I previously mentioned, if bleeding is getting heavier or more irregular, or you're having spotting in between your cycles, it's important to see your doctor to make sure nothing else more serious is causing that abnormal bleeding. Secondly, if the symptoms are definitely life-changing for you and are problematic to the point where you're not sleeping well, you're getting more fatigued, or you're just not feeling like yourself, come in and see your doctor, because there are definitely things that can be done to help the situation. Grand Itasca Clinic and Hospital, your partner in health.